B 7.42, correct. The pH is 7.35 to normal pH of blood is 7.35 to 45. So in this option, correct option is option B. Next question, blood is a acidic solution, basic solution, neutral solution, buffer solution. Actually it is buffer solution. Okay, what is meant by buffer solution? Buffer solution means a solution of a weak acid and its salt for maintaining a constant pH, especially of the blood. The three principal buffer system of in our body is very important. Are what are the buffer system present in our body? Protein buffer system, carbonic acid bicarbonate buffer system, and phosphate buffer system. Okay, the protein buffer system is the most abundant buffer system in the intracellular fluid and blood plasma. For example, protein globin into hemoglobin of blood is a good buffer within the blood cells. Actually, you don't need to read more about buffer system, just understand blood, our blood, or what are the three buffer system, that is carbonic protein buffer system, carbonic acid buffer system, bicarbonate buffer system, and phosphate buffer system. Okay, next one, the blood contain 90% of water, 80% of water, 95% of water, 60% of water. Correct option is option D, 60% of water. Blood contain 50 to 60% of straw colored liquid called the plasma. Plasma contain 91.5% water. Okay, correct, that is 60% of water. Which of these comprise of blood? Red blood cells, white blood cells, platelets, and plasma. All of this red blood cells, white blood cells, platelet, plasma, everything included in the blood, all together we can call as blood. Is the correct option, all of this. The cells, RBC, WBC, platelets containing fluid, that is plasma, that circulates through the heart and blood vessels and transport nutrients, electrolytes, hormones, vitamins, antibodies, heat and oxygen to the tissues, and taking away waste matter and carbon dioxide from the tissue called blood. Blood is the normal and exact important circulatory system. That means it is a transporting system for everything: electrolyte, nutrients, hormones, vitamins, antibodies, heat, oxygen, carbon dioxide, waste material, everything transported in this through this blood only. Okay, what is the normal blood cholesterol level? Here you can see so many this one normal values. It is not more than 200 mg per dl, less than 200 mg per dl, and 1000 to 1500 mg per dl, 500 to 1000. The correct option is option B, less than. Blood cholesterol level, it should be less than 200 mg per dl. Next, the normal cholesterol level in the blood is up to 200. Okay, bilirubin is formed from heme, globin, transferrin, gastroferrin. Correct option is option A. It is formed from heme. It is formed because of the destruction of RBC. Okay. Bilirubin is a yellowish pigment present in the bile. It is formed from heme part of the hemoglobin after destruction of RBC. Graveyard of RBC means that is spleen. Once it is destructed, once it is destroyed in our body, in our spleen, it becomes like a bilirubin. It forms bilirubin. They are destroyed and ingested by the macrophages of the liver, spleen, and the red bone marrow. Okay, next question. Excessive hemolysis may result in the accumulation of which substance in the body? Hemolysis, excessive hemolysis will cause accumulation of which substance? That is excessive. Because of the excessive hemolysis, there will be destruction of RBC. More RBC will be destructive. Because of that, what will form? Bilirubin will form. Excess bilirubin will form. Okay. Next question. All of the following are plasma proteins found in blood except one. All of the following are plasma protein. What are the plasma protein is there? Albumin is there, globulin is there, fibrinogen is there, but myosin is not a plasma protein. Myosin is not a plasma protein. It is present in muscles. Next question. Plasma protein means a protein present in blood plasma. For example, albumin, globulin, fibrinogen. Which plasma protein is most abundant in the blood? That is albumin. Albumin is the most abundant plasma protein in the blood. It maintains the viscosity, that means thickness of the blood. Albumin, because of the normal amount of albumin only, we are maintaining the viscosity or thickness of our blood. Myosin is a protein present in muscle fibers. It constituting 45% of total muscle protein. Okay, that also another point, very important point. Myosin is present in muscle fibrils. This is a protein only, but it is present in muscle fibrils, and it's constituting 45% of total muscle protein. Okay, next one, the plasma protein that maintain oncotic pressure. Already given answer. What is maintaining oncotic pressure or the viscosity of blood? That is albumin. Albumin is the most abundant plasma protein in our body or blood. Oncotic pressure means osmotic pressures which are exerted by colloids in the solution, like a plasma protein into blood. Actually, it should be cleared, but we don't have enough time to teach. Already, I think I explained blood, everything I explained very detailedly. If you want to study that one, you can go and watch that videos. Otherwise, just understand albumin is a type of plasma protein. It is most abundant plasma protein in our body or blood, and it is maintained because of the presence of normal level of albumin only. Our blood is having that viscosity, that means thick blood fluid. Okay, otherwise it will be watery, fully watery. Is it? Okay, albumin is the smallest but most abundant protein in the blood, play major role in maintaining oncotic pressure. Because of the oncotic pressure only, our blood is circulating in our body. It's not leaking out of the blood vessels because of the oncotic pressure or because of the albumin or contents of the blood. Okay, what is meant by oncotic pressure? Oncotic pressure means osmotic pressure. That means saying only osmotic pressure caused by plasma colloids. Colloids means the same like plasma proteins and all. Okay, then plasma colloids maintain the osmotic pressure. That one is known as oncotic pressure. Next one, a plasma protein that maintains normal plasma osmotic pressure. What is that? That is correct option. Option A, albumin. Albumin is the plasma protein. So one type of plasma protein maintaining and having a what's very big role, important role in maintaining osmotic pressure. Okay, which is the plasma proteins that constitutes about 40 to 60% of total plasma proteins. Correct option. Option D, albumin. Okay, already everything in different types question they ask, a correct option or albumin only. Which of the following is considered as an indication for administering serum albumin? When we have to administer serum albumin, to maintain oncotic pressure, if the blood oncotic pressure or osmotic pressure is very less or it is not normal, it is very less, reduced means we have to administer albumin. Okay, next, a patient with a prolonged protein deficiency will manifest with a low plasma proteins, which will affect the maintenance of osmotic pressure. If any patient with a protein deficiency disorders, definitely in their blood there will be low plasma protein only. It will affect our blood osmotic pressure. Okay. Next question, hydrostatic pressure which pushes fluid out of the capillaries is opposed by colloid osmotic pressure which involve the pulling power of albumin to reabsorb water. What is meant by hydrostatic pressure? This is blood vessels. In this inside blood is there. In this water present in this blood, no, it will have a pressure to move out of the blood vessels. That pressure is known as hydrostatic pressure. Inside so many colloids is there. That means plasma proteins like a colloids is there. These colloids will exert a pressure like restricting or against, it will be exerting against hydrostatic pressure. That's why these blood cells fluid and all staying inside the arterial or venous or blood vessels only. Okay, that pulling power is known as osmotic pressure. Pulling power of albumin to reabsorb water, or albumin or osmotic pressure will pull and we're having a pressure to inside of the blood vessels, but hydrostatic pressure will be putting pressure outside of the to go out of the blood vessels. Okay, next one, the insufficiency of this substance in the blood may lead to edema of the body. What is that? That is albumin. Why it is occurring anemia? If there is absence of albumin or a deficiency of albumin, if there is a deficiency of albumin in patient, it will leads to reduced viscosity of blood. Because of reduced viscosity, this osmotic pressure will decrease. Because of the reduction of osmotic pressure, this fluid or water content of the blood will leak from blood to interstitial spaces. That means outside of the blood vessel, that means in between cells, so the particular part become edema or swelling. Okay, in the blood, albumin helps to maintain blood volume and blood pressure. Decrease amount of albumin cause decrease osmotic pressure of blood, which leads to seep out of fluid into higher osmotic pressure, that means interstitial space, and cause edema. Next, when hemoglobin combines with the oxygen, it is known as oxyhemoglobin. Correct option, oxyhemoglobin. Oxygen, when it is combined with the hemoglobin, it is known as oxyhemoglobin. Hemoglobin that reversibly bound to oxygen to the capillary of the lungs, alveoli called oxyhemoglobin, but it is unstable compound. Next, carbon dioxide combines with the hemoglobin, it is known as carbaminohemoglobin, not carboxyhemoglobin, that is carbaminohemoglobin. Carbaminohemoglobin. Okay. Next, what is that? About RBC. Lifespan, repeatedly asked question. Lifespan of RBC, fetal RBC. What is the lifespan of fetal RBC? What is the lifespan of adult RBC? That is 120 days. In fetal RBC, it is 80 days. Fetal RBC have shorter lifespan compared to adult RBC. Adult RBC is 120 lifespan, 120 days lifespan is there, but in fetal RBC it is only 80 days. Fetal hemoglobin has better oxygen binding capacity than adult hemoglobin. Okay, we understand that one. Next, normal adult hemoglobin contain what are the chains in hemoglobin? That is 2 alpha chain, 2 beta chain, 2 alpha chain and 2 beta chain. Next, which of the following is correct concerning fetal hemoglobin? Which of the following is correct concerning fetal hemoglobin? That is HbF is composed of 2 alpha and 2 gamma subunits. Okay, what about the fetal hemoglobin? There is 2 alpha and 2 gamma subunits present. Okay, that is fetal hemoglobin. Next, lifespan of RBC. It is mentioned, not mentioned like adult or pediatric, fetal. That means it is adult only. That is correct option is option A, 120 days. Next one, red blood corpuscles are formed in. Red blood corpuscles are formed in. Where it is formed? In bone marrow. Red blood corpuscles or red blood cells formed in bone marrow only. All blood cells are formed in bone marrow only. Okay. Red blood cells are synthesized in the embryonic life in the where it is in the embryonic life, it is formed, RBC formed from yolk sac. Okay, it is formed from yolk sac. Which organ is the primary site of hematopoiesis in the fetus before mid-pregnancy? That means first trimester and all. What is the primary site for hematopoiesis? That is liver. Okay, liver is the primary site for the production of blood cells. Okay, next, the term used for the process of RBC formation, what we can call it for formation of or production of RBC, that is erythropoiesis, because RBC is the otherwise known as erythrocyte and the production of RBC is known as erythropoiesis. Next, which single feature of normal RBCs is most responsible limiting their lifespan? What is the limitation? What is limiting the lifespan of RBC? That is lack of nucleus. A very, very important point in blood cells. RBC does not have nucleus. The WBC and all we have nucleus, but in RBC it doesn't have nucleus. During maturation time it is expelled out, so it does not have nucleus. Very, very important. Next one, normal reticulocyte count of blood. What is the normal reticulocyte count? You study now itself, 1 to 2%. That is normal reticulocyte count. Reticulocytes are the last immature stage of the red blood cells. Reticulocytes normally constitute about 1% of the circulatory red blood cells. Next one, nursing care for a patient who has polycythemia, where polycythemia vera would focus on preventing what? Polycythemia. That means RBC becoming increased. That means increased hematocrit above normal level is known as polycythemia. It's because of the increased count of RBC. That is polycythemia. Because of that, what may occur? Thrombosis may occur. May clot may be forming. Thrombosis may occur. Okay. Next question. A client with a COPD has secondary polycythemia. The nursing diagnosis that would be included in the care plan. What will be the important findings? First thing, the RBC is excess and thrombosis is forming. Or thick blood means in our tissues or other organs will not get enough circulation, enough blood. That is the first concern, first nursing diagnosis. Impaired tissue perfusion related to thrombosis. Impaired tissue perfusion related to thrombosis. Next one, which of the following is the most mature normoblast? Normal, which is this and all they will not ask, very rare question. First, this is most mature normoblast means orthochromic normoblast. Okay, orthochromic normoblast. Next one, the total RBC count for woman is 4.2 to 5. 4.2 to 5. Okay, 5 lakh. Okay, 4 lakh. 4.5 to 5 lakh. Next one, which of the following is the most abundant type of blood cells? Most abundant type of blood cells is RBC, otherwise known as erythrocyte. Next question, the average HB count of human blood is 14 to 16 gram per DL. Okay, 14 to 16 gram per DL. Next one, the normal diameter of RBC is 7 to 8 micrometer. Normal diameter of RBC is 7 to 8 micrometer. Hemoglobin is a type of what? It's a respiratory pigment because hemoglobin is carrying oxygen and carrying carbon dioxide. So it is a respiratory pigment. Next one. What is meant by ESR? What is the full form of ESR? Erythrocyte sedimentation rate. Erythrocyte sedimentation rate. That is the full form of ESR. Next one. The best test to assess the prognosis of patient. Best test to assess the prognosis of patient is through erythrocyte segmentation rate. Okay. What is meant by hematocrit? Hematocrit means could be increased due to hematocrit means it's an amount of red blood cells only, blood cells only could be increased due to increase in EPO released by the erythropoietin released by the kidney because of erythropoietin secretion. Who is secreting erythropoietin? Erythropoietin is secreted by kidney only. Once kidney does not receive enough blood, it will produce erythropoietin to increase the production of RBC. Okay, the hematocrit could be increased due to increase in erythropoietin released by the kidney. Okay, that is another topic only. It's very important. Okay, next, what is the approximate normal level of hematocrit? Normal hematocrit is that is 40 to 50%. Okay, 40 to 50%. A patient who has history of chronic bronchitis is admitted to the medical unit. Chronic bronchitis. Now, just think chronic bronchitis. Admitted to the medical unit. The nurse notes the red blood cells count is elevated. RBC count is elevated. Which of these is the likely to contributing factor to this lab result in this patient? What is the condition which contributing the elevation of RBC? Correct option is chronic hypoxia. Chronic, because of the chronic hypoxia or because of the lack of oxygen, what leads to? It leads to the increased production of red blood cells. Okay, here we are finishing today's class. Today we finished our RBC, blood and RBC. That rest of the portion we will take in the next class. That means tomorrow. Okay, whatever we are reading, you just take a short time and just listen. And we are in these videos, we are not going to give an explanation because you people don't have time. Even though I am having time, you people don't have time to study and hear and watch more videos. So just focus on questions and write out the points and study well. Okay, don't waste time. Thank you for watching. Bye bye.